So I've heard this before, and let me know if this is true or not, that it takes about 20 years before the research reaches the practice.
Oh, that's a great question. I think that it really has to do with who you are as a doctor and what you're talking about specifically, and also how aggressively you love continuing education or seek out continuing education. Whether you love it or not, I guess, is a little bit of a moot point, but how aggressively you seek out continuing education. If all states are different, but it seems to me that most states require doctors to have somewhere between 10 and 20 hours a year. And some of those are mandated. We have to have drug training, we have to have ethics training, and there's a handful of them that we have to have, which there's nothing wrong with that. But once you remove all of your mandated training, there's only a few hours left. And so it becomes difficult to change up a system. And if you're seeing research that deeply perturbs your ability to work, you need a lot of hours to sink into that, to really change how you process or what you do. So I think that it's very difficult to answer that correctly, because I think that you're going to find some doctors that don't ever change. What they learned in dental school is what they're going to practice when they retire. And then you're going to have other doctors that are changing stuff up every 3 to 5 years. And unfortunately, I don't know how to identify that difference on the outside, but I do agree with you that it takes a long time. There are some doctors that are aggressive on learning and implementing, and there are others that I'm not going to do anything until I'm forced to do it.
Yeah.